Come in.
Hi, Mr. Petersen. My name is Corey, and I'm going to be your student nurse today. Can you tell me your name and birthday?
Yep, Kevin Petersen, 9378.
Okay, perfect. So, your doctor has requested an NG tube to be placed. Have you ever had an NG tube?
No.
Okay. So, an NG tube is a nasogastric tube that goes from your nose to your stomach. And it has several functions, but the one we're going to use today is for tube feeding. Tube feedings are used when a patient has trauma to the head and they can't swallow, they have cancer to the throat, they've had a stroke. There's just a number of reasons why a patient would need tube feeding so that we can make sure that they're still getting the nutrients that we need.
Okay.
So I have my supplies over here. So the first thing I'm going to do is provide for privacy. I'm going to do hand hygiene. So all of my supplies are over here. I have my towel that I will place over you so that we don't get any kind of contents onto your gown, okay? And then I have my gloves, my pen light, tape, my lubricant, tubing, my syringe, the water that I'm going to have you drink while we're doing this process, and then Kleenex and a container for the if you were to vomit or anything like that, and then my pH strips. So we're going to go ahead and get started here. To do this process, I need to raise the bed up so that my back doesn't have any problems and I can reach you easily. And then I'm going to bring you up into a semi-Fowler or high Fowler position. Do you have any problems with being in a sitting position?
No.
Okay, good. All right, so there we go. So this is a clean procedure, so I'm going to put my gloves on. And during this procedure, I'm going to need some help from my assistant. He will help with the water when it's time for that. And then he will call for the x-ray. Have you ever had a chest x-ray before?
Yeah, I've had a few.
Okay, good. All right. So I'm going to need you to tilt your head back when we start this process and then tilt it forward after a certain part. But I'll let you know. If you have any problems with breathing or if you begin to cough or gag, then I will need you to let me know and we will stop the procedure and see what's going on, okay?
Okay.
All right. So the first thing I'm going to do here is take my tubing and I'm going to measure it to see how long or how much tubing we're going to need for this procedure. So to do that, I will take it from the tip of your nose to the earlobe and then from the earlobe to the xiphoid process. And we're going to go at about 30. Now, the next thing I need to do is check your nose. Have you had any kind of trauma to your nose at all?
No.
Okay, have you ever broken your nose?
No.
Okay, I'm going to look here and just make sure that the tissues look good. They're nice and pink. I don't see any obstructions. The outside of your nose looks good. So yeah, I can tell you haven't ever broken it before. Okay, so now what I'm going to do is I'm going to close off one side of your nose and I need you to breathe for me and then we're going to do the other one. And I'm just deciding which nostril will be better to use, okay?
Okay.
All right, so here we go. Okay. Oh, okay, so I think the right side is going to be the better one to use, okay? All righty. So, are you allergic to anything?
No.
Okay, good. So I'm going to put some lubricant on the tip of this, just to make sure that it goes in nice and smoothly so that we don't have any problems. Okay, are you ready?
Yep.
Okay, all right, so here we go. So I'm going to have you tilt your head back. Okay, all right, here we go. Very good. Okay. Now I'm going to have you tilt your head forward. I'm going to have you touch your chin to your chest. My assistant is going to hold the water for you. And if you have any problems as we're going, be sure to let me know, okay?
Okay.
All right, here we go. Okay, keep drinking. Keep drinking. I'm going to turn that. Oh, are you okay?
Yeah.
Okay, I'm going to stop here for just a minute. And I'm going to have you open up your mouth. Okay, it's not coiling back there, so that's good. All right, so we're going to go ahead and start again, okay?
Okay.
All right, here we go. You doing okay?
Yep.
Okay, and we're almost there. Keep drinking. Keep drinking for me. Okay, here we go. All right, so we are at the 30 mark. So I'm going to get some tape here. I've already put this tape out. So this first piece of tape that we're going to use is going to just keep this in place while we wait for the x-ray to get here. So I'm going to have my assistant go ahead and call for that x-ray now. And while we're waiting, I'm going to do a couple of tests just to be sure, okay?
Okay.
So I'm going to wrap this tape here around the tubing to make sure that it stays in place. Oops. All right, there we go. Okay, so the first test that I'm going to do, I'm going to take my syringe here and I'm going to take out approximately 10 milliliters of your stomach contents. And what I'm going to do here is check for the pH of it, because if it were in the intestines, the pH would be above 6. And if it was in the stomach, the pH would be between 1 and 5. So we're going to check that real quick here. You still doing okay?
Yep.
Okay, good. All right, so I'm going to put this in my container here.
It doesn't sound like my roommate's doing very well.
No, probably not. Okay, so I'm checking the pH here. So I have my little card here. It indicates what the different numbers are. And I looked at the contents when I had it in the syringe and everything looks good. So it matches what I would expect to see with the stomach contents. So this here is a 3. So that's between 1 and 5. So it looks like I have it in the stomach there. So next what I'm going to do is put in 20 milliliters of air. And what I'm looking for here is a sound. I'm going to be listening with my stethoscope to see if I hear a whooshing sound as it goes in. And that will also tell me if it's in the right place or not. So let me put my stethoscope on. All right, here we go. Perfect. There's that whooshing sound. So that is our second indicator that it's in the right place. And x-ray is here now. So we're going to go ahead and let them do the x-ray. Okay, so the x-ray has come back and the tube is in the right place in the stomach. So we're going to go ahead and finish this process here. So I am going to take a piece of tape here and just put it over the bridge of your nose just to make sure that this tubing stays in place. And then my other piece of tape here, I'm going to put on your gown with a little bit of the tubing there. And this is basically just going to keep it from moving around. If it were to get caught on anything, it would keep it from coming out of your nose. So let me take a piece of tissue here. I kind of got a little bit of the lubricant on your nose here, so just let me clean that up for you real quick.
Well, thank you.
Oh, you're welcome. All right. So my procedure is done for now. We just have to wait for the doctor to do the orders. And then I'll come in with that feeding and explain a little bit more about it and how it's going to work and what we need to do. So now what I'm going to do is I'm going to close this off since we're not going to be hooking it up to any suction right now. So if anything were to come out of the tubing and come down, it won't get all over your bedding or your gown at all. So I'm going to go ahead and lower your bed. I'm going to keep your head elevated. I'm going to keep it at least 30 degrees for now. And then I'm going to have you roll to your right side so that we can just make sure that everything stays in place for now. So I will take my gloves off. I will do hand hygiene. Do you have any questions for me right now?
Nope.
Okay. All right. Your call line is to your left. So if you have any questions or if you feel like you're short of breath or you start coughing a lot or have any problems at all, questions, concerns, whatever, just please call and I will come and explain anything that I can to you, okay?
All right.
All right. So now I will discard my things into the garbage and just let me know if you have any questions, okay?
All right.
Okay, thank you.
Thank you.